Hi there and welcome to the channel. I'm Dr. Emily Carter, and today we're going to address a topic that generates significant curiosity, anxiety, and unfortunately a great deal of misinformation. What is the normal penis size? And perhaps even more critically, how do you accurately measure both length and girth? With the substantial rise in male genital cosmetic procedures, this question has become increasingly common in clinical settings, online forums, and social media platforms. But before we proceed any further, I want to begin by reassuring you with something that may genuinely surprise you. Approximately 95% of men who express concern about the size of their penis are actually within the medically normal range. Yes, you heard that correctly. In the vast majority of cases, we're not addressing a physical abnormality, but rather a distorted body image perception. A significant number of men perceive their size as inadequate due to unrealistic comparisons, particularly with what's portrayed in adult entertainment or online content, where exaggerated or even digitally manipulated bodies are frequently displayed. What's also clinically fascinating is that this concern is far more prevalent among men than women. While approximately 55% of men report feeling anxious or dissatisfied about their penis size, only 5 to 10% of women indicate they consider it a highly important factor in a partner. So, take a moment to breathe. My objective here is to educate, inform, and most importantly, provide you with clinical clarity and peace of mind. In this video, I'll share real scientific data, explain how to properly measure both length and girth, review the procedures that exist for enhancement along with their associated risks, and we'll even examine a historical perspective that might fundamentally shift the way you think about this topic entirely. Let's begin by understanding how penis size is measured correctly from a clinical standpoint. Now let's discuss how penis size is actually measured, because this component is essential for understanding what constitutes normal parameters. There are two primary dimensions to consider: length and girth, which refers to the circumference or thickness of the shaft. How to measure length. Penis length can be measured either when erect or when flaccid and stretched. Both methods are utilized in scientific research. However, the most consistent and clinically reliable method is the flaccid stretched length, which closely correlates with erect length and is the standard I recommend in my practice. To measure correctly: 1. Use a rigid ruler or flexible measuring tape. 2. Place it at the pubic bone, precisely where the penis meets the body. You may need to gently compress into the suprapubic fat pad to reach the bone surface. 3. Stretch the penis outward, not forcefully but with firm, consistent traction while flaccid, and measure to the tip of the glans, the head. The same process applies when erect. Begin at the pubic bone and measure to the tip, keeping the ruler positioned on the dorsal surface aligned with the shaft. It's clinically important to avoid measuring from the skin surface alone or from the ventral aspect, as this adds artificial length and leads to inaccurate measurements. How to measure girth, circumference. Girth is equally significant as length in clinical assessments and can vary considerably between individuals. To measure: 1. Take a soft measuring tape or even a piece of string that you can subsequently measure against a ruler. 2. Wrap it around the mid-shaft of the penis, neither too proximal to the base nor too distal toward the tip. 3. Record the measurement where the tape meets. You can perform this measurement both flaccid and erect for comparison purposes, but in most clinical studies, erect girth is the standardized measurement. Many men tend to overestimate or underestimate their dimensions due to improper measurement techniques or by comparing themselves in non-erect states to others in fully erect states, which creates fundamentally unrealistic expectations and unnecessary anxiety. Coming up next, I'll walk you through what the actual scientific literature tells us about averages, so you can understand where the majority of men truly fall within the distribution. All right, now that we understand how to measure penis size correctly, let's examine what the peer-reviewed science actually demonstrates. There was a comprehensive, large-scale meta-analysis conducted with data from nearly 15,000 men worldwide. This type of systematic review combines data from numerous independent research studies to produce statistically reliable averages with high confidence intervals. Average length. When measured erect or flaccid and stretched, approximately 90 to 95% of men fall within the following range. Length between 10 and 16 centimeters. That's roughly 4 to 6.3 inches. The global mean length is around 13.2 centimeters, or just over 5 inches. So if you fall somewhere within that range, you are completely within normal parameters. Now, on the extreme ends of the distribution, there are specific medical definitions. A micropenis is clinically defined as an erect or stretched length of less than 7.5 centimeters, or approximately 3 inches. A macropenis, which is exceedingly rare, is generally considered above 24 centimeters, or over 9.5 inches. However, it's crucial to understand that these cases are statistical outliers and represent only a very small fraction of the male population. Average girth, circumference. Girth varies as well, and again, the substantial majority of men fall into a typical range. Flaccid stretched girth, between 8 and 10.5 centimeters. That's 3.1 to 4.1 inches, with a mean of 9.5 centimeters, or approximately 3.7 inches. Erect girth, between 10 and 13 centimeters, approximately 3.9 to 5.1 inches, with a mean of 11.5 centimeters, or about 4.5 inches. So when patients or researchers discuss being average, these are the actual empirical numbers they're referencing. Unfortunately, many men compare themselves to unrealistic standards, particularly those depicted in adult films where performers are specifically selected for unusual anatomical characteristics. And even then, camera angles, lighting, and post-production editing significantly exaggerate the visual perception. The clinical takeaway here is straightforward. If you're within these ranges, you're in the vast statistical majority. And even if you fall outside the typical curve, that doesn't define your health, your desirability, or your masculinity in any meaningful way. Before we continue, I want to share something important. If you're someone who has felt frustrated, perhaps even embarrassed about performance in intimate situations, or if you've noticed changes in stamina, sensitivity, or desire, you should understand that it's not your fault, and you're certainly not alone in experiencing these concerns. There's actually a straightforward, completely natural approach that has been quietly helping over 63,000 men regain their confidence, restoring firmness, drive, and that solid strength without pharmaceutical interventions, injections, or risky alternatives. It's a quick 7-second technique you can implement at home, and it functions by supporting what researchers are calling the manhood molecule, a key physiological trigger for arousal, blood flow, and sustained performance. Simply point your phone's camera at the QR code displayed on the screen or click the pinned comment below this video to watch the brief presentation that explains precisely how it works. Now let's continue, because next I'll walk you through the cosmetic procedures some men consider, what's actually evidence-based and safe, and what to avoid at all costs from a medical standpoint. Now let's discuss something that an increasing number of men have been curious about: penile enhancement procedures. It's completely understandable to wonder if there's a way to modify or improve your size, but it's critically important to separate medical evidence from marketing claims and to fully comprehend the risks and limitations involved with each approach. Girth enhancement, increasing thickness. One of the more common cosmetic procedures currently available is aimed at increasing girth, and the most frequently discussed method involves injecting hyaluronic acid. Hyaluronic acid is a substance naturally occurring in the body and is widely used in facial aesthetic procedures as well. When injected along the shaft of the penis, it can increase girth by approximately 2 to 3 centimeters temporarily. The effect typically lasts around 12 to 18 months, depending on the specific product formulation and individual metabolic factors. It's considered relatively safer than alternative substances and is gradually absorbed by the body over time. However, not all injectable materials are safe, and this is where I must be very clear with you. Some clinics offer non-absorbable fillers, such as PMMA, polymethyl methacrylate, or even industrial-grade silicone. These substances can cause severe complications, including chronic inflammatory responses, formation of hard lumps or nodules, significant deformation, irreversible damage to penile tissues. For these compelling reasons, these substances are not recommended by reputable medical organizations, and I strongly advise against them in my clinical practice. Lengthening procedures. When it comes to increasing length, options are considerably more limited and carry greater risk profiles. Two procedures sometimes offered are: 1. Liposuction of the pubic area. This removes adipose tissue around the base of the penis, making more of the shaft visually apparent. It doesn't actually increase true penile length, but can improve aesthetic appearance in men with significant suprapubic fat deposits. 2. Suspensory ligament release. This is a surgical procedure that transects the ligament holding the penis close to the pubic bone. This can add approximately 2 to 2.5 centimeters of visible length when flaccid, but it does not increase erect length. Additionally, it may cause instability during intercourse, and there's a significant risk of complications, including scar tissue formation and altered erectile angle. Importantly, there are no permanent, medically approved methods for true penile lengthening that are endorsed by most international medical bodies or regulatory agencies. And finally, it's essential to clarify that penile implants, which are sometimes sensationalized online, are not designed for size enhancement purposes. They are medical prosthetic devices used in the treatment of erectile dysfunction and are only indicated in specific clinical cases where other treatments have failed. Coming up in our final segment, I'll share a historical perspective that might fundamentally change the way you think about penis size, and I'll conclude with some final clinical thoughts. To conclude, I want to leave you with a fascinating piece of historical context that might transform the way you approach this entire topic. In ancient Greek culture, the ideal male body was actually portrayed with a smaller penis, and this was considered a sign of wisdom, self-discipline, and intellectual rationality. In contrast, large penises were often associated with barbarism, lack of self-control, or even comedic exaggeration. Just examine the classical sculptures of great gods and philosophers. You won't find oversized anatomy represented. And when large penises did appear in ancient art, they were typically part of caricatures or depictions of mythological figures like Priapus, who was literally a fertility god portrayed with grotesquely exaggerated anatomy for satirical or ritualistic purposes. Why does this historical context matter? Because it demonstrates that cultural ideals about masculinity and size change dramatically over time. What's considered ideal in one era can be the complete opposite in another historical period. That means a significant portion of the anxiety men feel today is based more on contemporary social influence and media exposure than on any biological truth or functional necessity. So, if you've ever felt insecure or pressured by what you see online, in mainstream media, or even from locker room conversations, you're certainly not alone. But hopefully this video has helped provide some clinical perspective and evidence-based reassurance. At the end of the day, penis size does not define your worth, your capability to please a partner, or your masculinity. What genuinely matters is your confidence, your respect for others, and your overall health, both physical and psychological. If you found this content helpful and informative, don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss more science-based, judgment-free content like this. Thank you so much for watching. I'm Dr. Emily Carter, and I'll see you in the next video.